The American College of Obstetrics and Gynecology says we should be screening every pregnant woman universally. That means we don't judge, ooh, I think you should get a screening for use disorder, but you shouldn't, right? We should do it for everyone. And there are multiple ways to do this, but the biggest thing that's so important is that if we're screening, we don't just do a checkbox and then like approach women like this, like, ooh, you know, using drugs is really bad for you. They know it's really bad for them, right? They're terrified. They're terrified for themselves. They're terrified for these babies. We have to do better than that. We have to engage them and reach them in a positive way. Thank you so much for telling me. I'm so glad you're here. What a brave and amazing woman you are for coming forward and talking about this, right? All they hear is, you're a terrible mom. How could you do this? What's going on? But that's actually gonna make people run away, not come closer, right? So beyond universal screening, we're trying to engage women, we're trying to stay positive, but how positive can we be? Like, has she already messed up this pregnancy? Like, what happened? There are lots of general concerns with substance use in pregnancy, but I would say these are the 4 big things that I hear. Number 1 is teratogenicity, which means birth defects, right? This is what is in the back of mom's mind. They're like, oh my gosh, my baby's now deformed. There's development risks, right? We worry maybe these babies aren't developing normally, maybe they'll have behavioral problems. There's obstetric problems that we worry about as physicians a lot, like what if there's a problem with the pregnancy? And then of course there's neonatal abstinence syndrome, which I'll talk a little more about. But I just want to dive into birth defects quickly and first because it's actually good news. So we've studied opioids specifically, and there have been tons of studies, retrospective studies, a lot looking at this. And really when it comes to prescription drugs, the one that has popped up the most is maybe codeine, and even that one isn't replicated in other studies. In general, most opioids don't cause birth defects, okay? And buprenorphine and methadone, which are treatment medications for opioid use disorder, are generally thought to be safe, okay? So the SAMHSA national guidelines, which just came out this year, says to date, research has not shown that buprenorphine and methadone can cause an increase in birth defects and minimal long-term neurodevelopmental impact, okay? So that means these treatment medications that we use are safe, and research that we have so far says we should do that. So why all this fear about, like birth defects and developmental problems? Well, that's not the story for all substances, right? So fetal alcohol syndrome was described in the 70s. Fetuses, when they're developing, are exposed to alcohol. They have a very different outcome sometimes. Not 100% of the time, but alcohol is cytotoxic, which means at certain levels, cells actually die. That's not the same for other substances like opioids, stimulants, and other things like that. But we think in our society, oh my gosh, if alcohol does this, right? If alcohol causes birth defects and developmental stuff, what must cocaine do? Like crack has to be way worse, right? And so in the 80s, right after FAS came about, there was an epidemic of cocaine, and everyone thought like these kids are gonna grow up to be, have all these problems, they're exposed to cocaine in utero, right, when the mom is pregnant. So luckily people spent their entire career studying this, okay? And there was a JAMA article which looked at all the research combined together that basically said this. When you correct for poverty, the housing, the home situation, education, and drug use in the home, there's no difference for babies that were exposed in utero and not, okay? There's no significant difference. So what does it matter? Does it matter that they were exposed here, or does it matter how they grew up? It matters how they grew up, okay? So the take home here is it's not too late. And the real risks that we need to worry about are actually obstetric. So like from my doctor hat on, right? I actually worry that when women are using and actively using in pregnancy, that the risks are early labor, early birth, all these problems that can come from that, problems to the pregnancy, and also later in parenting if that mom doesn't get help, right? So if that mom doesn't get good treatment, the parenting is a problem. So opioid withdrawal, when it's rapid and uncontrolled, can actually cause bad outcomes. And of course, infection and poor nutrition and trauma exposure and all those things happen when women are actually using. So what about neonatal abstinence syndrome? People talk about this a lot, and this, when we're talking about babies, this is like the tagline, right? Like that article I read you, this is what everyone's talking about, these poor babies and NAS, right? So here's the thing. If you have women who are using substances, NAS will happen, not 100% of the time, but there's a risk. It's actually confounded by a lot of other things too. Nicotine antidepressants, and we're not going to stop using those. They're really important, right? Other substances, caffeine can confound this picture. And what we're really talking about a lot of times is opioids, but a lot of people don't know to recognize and treat and look at those other things as well. And here's the truth. We have some amazing studies that are done. The Mother trial was an old Sentinel article in Medicine that basically compared buprenorphine and methadone as two treatment medications and what happens with NAS rates among those two treatment medications. And they found that the rates were about the same in that trial, but with buprenorphine, babies needed less medicine and in shorter hospital stays, so they had less severe symptoms. And actually, recent research out of Yale is saying that when we do things that we already know help calm babies down, right? Breastfeeding, being with mom, skin to skin, cuddling, things like that, as opposed to putting them in a sterile bed. I know that if they had put my baby in the NICU after my first kid, especially after she was born, she would have screamed nonstop for like 5 weeks, right? But when she was on me and cuddled, she was fine. This is the same with NAS. So it actually went down, the incidence went down to 14% on medicine when they were doing these like cuddling, rooming in, being with mom, all those interventions. And the truth is that it looks nothing like that article, right? It looks like this beautiful sleeping baby when we catch it and screen and treat appropriately, and babies can be fine, okay? Babies are not born addicted. They may have a dependence, but that can be treated, and they're not gonna grow up. Research shows they're not gonna grow up to have addiction later. The only risk is the genetic risk that they have, because it is a genetic risk of addiction, or if they, again, grow up with trauma in a home where people are using, okay? So how do we prevent that? We appropriately treat substance use disorders, okay? I'm sure people in here have heard of medication-assisted treatment. There's a lot of talk about it recently, but it's a combination. It's medication-assisted psychotherapy, right? Using medicine. So medicine has advanced a lot, and we have to use those advancements just like we do in cancer, just like we do in everything else. We have great medications to treat opioid use disorder. And that's not true for a lot of others, but it is for this. We know these medicines are approved and safe in pregnancy, and not just that, they keep the moms from relapsing, but they also have safer babies when women take this treatment if they have opioid use disorder. So that means babies are bigger, healthier, and born on time, okay? And why not detox? It seems so great, like maybe we could just detox these women slowly, which is safe from a pregnancy standpoint, and then the babies won't have NAS and it'll all be fine. But they've studied this over and over again, and what the studies don't like pull out to show you, but it's so interesting, is that the NAS rates in babies who have been detoxed, in the pregnancies who have been detoxed, are just as high, if not higher. Why? Because moms relapse to use. They continue using when they're not on a medication that helps them not use, right? So it doesn't mean this is 100%, but it means that every woman should be offered the best treatment that we have, okay? So this is from ACOG 2017. That's like the Society of OBGYN, right? And they say that opioid agonist therapy, that's methadone or buprenorphine, is preferable to supervised withdrawal. Withdrawal is associated with high relapse rates, which lead to worse outcomes. And NAS is an expected and treatable condition in about 30 to 80% of infants taking those therapies. And we now know we can make it even lower if we're doing the other things that really help babies, right?